frescoes and tea.
All right, welcome back to The Link, everybody. Really big show. Obviously, this morning, Dr. Ho Nguyen, the chairman of the Physicians Advisory Group, passing down some information which is going to be very significant. And to kind of tie into that, we want to bring in Mary Rhodes, of course, our dear friend and the president of the Guam Hotel and Restaurant Association, for what the possible forthcoming restrictions may have on our island's most lucrative and most critical industry. Of course, that is hospitality. Good morning, Mary. Always good to see you.
Good morning, Mary.
Hi, good morning.
Thanks for joining us.
Company.
If we could just start at the beginning with Dr. Wen. We had him on, and it's kind of been a recurring theme throughout the week with the various public health officials that have made their appearances on The Link, talking about mask mandates, right? How important is this message when you stress it to the membership of the Guam Hotel and Restaurant Association? And what do you do to kind of impress upon them just how serious the mask mandate is and how it helps keep us safe?
Yeah, I think that in general, I mean, we always need to remember that we should not become complacent and always remember that it is a requirement. It's mandated by the executive order. And so that hasn't been lifted, as well as the sign-in sheets at your establishment. You need to make sure you have that, whether you, no matter what kind of business you are, if you're receiving customers or guests, visitors, you need to maintain that log because that's still required. So mask and contact tracing lists are still required. And so last week, because of the increase in positive cases, we needed to make sure we were recommunicating that back out to our members so that, especially because of the influx of guests, not just tourists, not just military, but also just an influx of a lot of local people having a it's just more people, right, out in the public. And so we needed to reinforce that messaging to enforce the mask mandate is being followed. But it's only the complexities increase as now we're seeing the positive cases with the Delta variant. And as you heard with Dr. Wen this morning, they know that it's been here since before the summer, the beginning of summer. And so a lot of these aren't being generated because of tourists or military per se. It's really because it's been here already, and it's the cases, the clusters that they've been seeing the last 2 to 3 weeks has really been directly through groups, through gatherings, and a couple of establishments. So that's really important. That's why actually the governor called me personally last Friday as well as Saturday to let me know that, of course, she appreciates everything that we do when we partner together with public health to make sure everybody is following the guidelines, but not just following guidelines, but just really doing everything we can to ensure the safety of our employees as well as our guests. And so when she said that, it became a lot more serious on Saturday, where we sent out our message because public health and as well as GPD had done some random site inspections. And so they actually started visiting all of the hotels and some restaurants over the weekend last week just to check on the protocols that are being followed. And I did not get any reports on citations. I know that those that they visited, they did not have any concerns, and they were looking more for walking around the venues, walking around the establishments, bathrooms, any kind of, any type of open space. They were looking for active eating, drinking. That's the only time you really should have your mask off. And so that's why I think a lot of times people really misconstrue where it's not targeting just hotels and restaurants, it's any gathering. It's any social gathering, whether it's outdoors, at a home, at a private venue. When they talk about these mandates, it's for any social gathering. You need to ensure that you follow those rules. And masks are regardless if it's indoors or outdoors, except for actively eating or drinking. And so we've been really impressing that this last week. And we know that, there are a lot more concerns as cases have risen, as well as hospitalizations as of last night.
I know that I don't know if they're still meeting, but the 8:30 meeting with the PAG and the governor, I'm pretty sure you caught Dr. Wen this morning, that they're going to be recommending restrictions to help kind of hammer down this, what he's calling a Delta surge. Did you have eyes on, ears on, anything on what type of restrictions may be coming down or recommended to the governor?
We've actually been sharing with our membership just what's been taking place within even Hawaii, Saipan, New York, California. A lot of these things have been taking place since the Delta variant has really shown up. And so there have been different applications of how to add more restrictions. But I think what's really important is we need to ensure that we continue to do the basics, as he said earlier today. And I think the key question is, coming back to some of the decisions they've already made, right? Like face-to-face schools. I think that's a huge concern, because if the schools can maintain protocols and still require masks, then why can't the business continue to do that? And I think the question is just really the limit on the gatherings and how much and make it up to the businesses really of if they're going to require certain things additional to the masks and social distancing. If that's going to be brought back up. But to scale back a little bit, as Dr. Lombard mentioned earlier, I think that with what Hawaii has done and even Saipan recently, the businesses understand that if they have to go back things. But I think that we just got through a whole month of this. And I think that we have to continue to kind of stay that course, because if we keep fluctuating between decision making, I think that it just really, the credibility of it and just how they're making those decisions and what is that plan for the long term, we really run the risk again of, like with the CDC, the way they put us out there for a higher level, whether GBB promotes us, continues to promote us with the airlines and all that it has to be packaged and planned, and the messaging has to all convey together. And I think that is generally what businesses are looking for, that guidance is, what is the plan? Same as parents and children in school, right? So I think that rather than being reactionary, I'd rather see what is really the plan every time we have this, because I think it's not just increase in vaccines, it's really about hospitalizations. And they've always said that the goal is herd immunity. And with 80%, we know people will continue to get positive. Whether you're asymptomatic or symptomatic, that's the expectation, because we're still dealing with a pandemic, but at some point it will become endemic, where we're living with it. Endemic is, it's already here and we're living with it, and we have to maintain kind of structure and guidance in how we move forward with this. And so I think that's really what businesses and families and the community is really looking for, is what is the plan and what are the triggers of this, because it can't keep changing from week to week. And I think that's what a lot of people are afraid of when they hear concerns, right, from Dr. Wen and the Physicians Advisory Group. So I think it'll be really important to kind of stay in touch with that throughout the day. I know that there's a town hall forum this afternoon that they're planning to have. And I don't know if they're going to be making an announcement that this afternoon with the town hall forum. But I think it's really important that we continue to impress upon on the things that we've done well and we've already established, because we've done so much work towards this. And we have really asked people to get vaccinated. So my goal is to still increase vaccinations within the workplace and our community. And as much as we can do that, the fewer we give the variants fewer opportunities to really truly affect us in a larger way. And so I think vaccinations still has to be the major play here in order for us to continue moving forward. Even if we take a step back or two, it can't be as restrictive. We can't take it all the way back, scaled back, because I think we just cause too much disruption, again, with schools and their families, but also with businesses. And I know some people are talking about, well, what about the 12 and under who can't get vaccines, right? Maybe we allow the 12 and over who are vaccinated to stay for face-to-face. however we treat different sectors should be the same. Because whether it's social gatherings or it's large pods of people, school systems are the same place, as well as the military are staying in the hotels for long periods of time. Maybe it's not social gathering, but they're large groups. And so we can't really put things, pigeonhole it into one thing. We have to look at as a larger picture of how we're going to handle this with the Delta variant.
Mary, you mentioned vaccinations in the workplace. The governor Saturday night, when she issued her Instagram video.
What time was that again?
At 9 o'clock.
So it was put out on a 9 o'clock on a Saturday night. It wasn't really an important video, though, because nobody's awake at 9 o'clock on Saturday night.
Okay, yeah. So she posted that video, and she was calling on the legislative branch, the judicial branch, and the private sector to follow her lead in implementing a vaccination mandate. And so I'm just wondering if in GHRA are those kind of discussions that hotels and restaurants are looking at having, where they would mandate that their workers get vaccinated, and maybe even possibly taking it a step further, that people who are going to check in, people who are going to come in and eat, must be fully vaccinated.
Yeah, we've had these conversations. We've actually also had some workshops with Society of Human Resource Management, GHRA, and the Employers Council, where we've talked about the legalities of it. And I think that with the federal government, they've already identified, you can't sue the businesses for putting in those job requirements. It's already been proven in the system. In Houston, Texas, a hospital was sued and it's gone to court twice, and the hospital won. So it's already been proven. And so we are continuing to work with GHRA and TEC. And I met with Guam's Chamber of Commerce yesterday, and I continue to talk to all the other organizations, Guam Contractors, Women's Chamber. We've seen banks. I know other businesses are choosing to mandate it. But I think it's really up to each employer, because there are some employers who just can't make those decisions because they're part of international branches or national chains. And so they always have to follow their corporate policies. So within private sector, I think the ask is to consider it, but those businesses have to make those decisions based on their employees, the liabilities. Also, how can they manage it with documentation, and there are HR questions of what do they keep on record. Until COVID vaccines are required, like tuberculosis, PPD testing, to go to work or school, then I think it should be up to each individual entity. But right now, the federal government hasn't required it, like a TB test, a PPPD test before work or school. So I think we're still educating people, and I think that's the job of GHRA, is provide resources and information. We don't generally give advice. That's really up to each private sector. But we do provide guidance on a lot of regulation and compliance issues.
Let's talk.
So we're planning on doing another one with TEC and GHRA with the chambers, together with GHRA.
Let's talk about regulation and compliance in unpacking the contact tracing that they did relative to the surge we're currently in. They had mentioned a wedding, I believe, at the Deuce. It was 300 people there, and then there was also a karaoke bar. I want to say men's karaoke bar, but they had issues in trying to investigate the contact tracing at this bar because they said that the owner was refusing to provide the sign-in sheet and just basically being uncooperative. Now, I know they're not a member of the GHRA, but are you guys talking to your membership about, and I know you said at the beginning you are, but how important those sign-in sheets are for situations like the one we're currently in?
Yeah, public health has a compliance department, DEH, and GPD is actually responsible for being that enforcement arm for them. And so there is a team or a crew within GPD that goes together with DEH if they have issues like that. So businesses need to remember that if it's part of the executive order and it is required under the executive order, that's really mandated because it's a public health emergency. And so the mask requirement and the contact tracing is mandated. And the contact tracing is extremely important because it will delay notifications to individuals, but also your employees. So it's just the right thing to do to share that because, and privacy doesn't apply to those businesses, not like, a medical doctor or psychiatrist. And, there are laws to protect individuals like that for those kinds of services, but that doesn't apply to service venues. So you have to furnish those lists. And so you have to continue to maintain it because there are violations and fees that can be applied to you, citations and monetary expenses on that per occurrence. And so it's very difficult to manage anything if you don't have information. And it also delays it, right? So imagine how many increases we've seen the last couple of days. That was how many weeks ago? So I'm just wondering what the numbers are going to be in the next, week or two. And I know Doc had mentioned it's going to be a 2 to 3 week process because they've just been working on the contact tracing the last 2 weeks. And so where did those clusters come from? So it's only going to go further back. And that's why I'm saying it's been here since the summer, before the summer. So our focus, again, is really at GHRA is to continue sharing the message, getting that out there, getting people vaccinated. We have a lot of things coming up, too, that nobody is really talking about. There's minimum wage coming up. PUA is going to be ending. There were plans to incentivize businesses to rehire. How can we rehire if we have so much influx going on? Yeah. And so I just think that there are a lot of reasons why businesses are very skeptical about reopening. Yeah. And it's been a challenge. And so even if they are open, and I know that, GDB had their board meeting yesterday and they're talking about, the activity we've had, but it's just, when you say 97% decrease going forward through 2022, it's a long process to rebuild this economy and our tourism industry. And so it's only going to really just make it more challenging for us as we continue to deal with this Delta variant. So whatever decisions are made today or this weekend, I just hope that we continue that communication. And I do have a great relationship. GHRA has always had a great working relationship with public health, DEH division especially, and even getting the messaging out with the governor and the PAG. But I just think that right now, these decisions in the next couple of weeks, it's really going to define how we're going to end the year and start even next year. But, our neighbors to Hawaii, like Sean said earlier, they went bold, right? And they just went back to 50% occupancy because it's very difficult to ask people to try to prove their vaccination if all they have is a paper card. And how do you determine in operations whether or not that person wants to even share their card with you? So even proof of vaccination is very hard to implement from an operations level. And so I think we have to think through how these are going to be mandated. And I know, Chris, earlier, you asked the question about even the government mandate, right, for the vaccines. How do you ensure everybody's going to get tested by October? And then how do you get ready to weekly rapid test or PCR test everybody? There are companies right now that do that today because they're required, like, let's say, inside the fence or any marine. To get onto a ship, there are marine requirements to have PCR tests. So like Cabris and the port, they require PCR tests on a weekly basis. There's some DCSP employees where they have to test. Even though they're vaccinated, they still have to test. And so those services are right now really at the clinics. So we have to ask ourselves, how fast can we even get lab results for everybody? So I just think we need to have more conversations as a community and as a business community with public health on how do we address this going forward. If there are going to be more mandates, how do we ensure we can execute them?
Mary, you mentioned the minimum wage. Wow. What are you hearing within the GHRA? Do you foresee request for another extension, or are we able to, you think, implement the minimum wage increase?
Yeah, it was very clear, I think for February, March, that, the original ask was 1 year in the bill that the senators put out, and they only accepted 6 months. And really, if we were to reintroduce a bill to extend it out, that would have been done a while ago, like even last month, as early as last month. And they've been in budget hearings. They're even out for now, right, to review the budgets that have been submitted. And so it goes into effect September 1. And we've been warning everybody, that it did get a 6-month extension. And so a lot of people have already planned to put it in. But I think that what's only going to make it a little bit more challenging is how soon do you hire people if you know that business is going to be stalled again, with possible, different restrictions on occupancy or gatherings. So it's different things that it just depends on how it's decided. But those things are firm, right? Minimum wage increase is going up September 1. We already know the utilities are increasing.
The PUA is ending on September.
PUA is ending in September. The fiscal period ends starting October 1 is a new budget.
Right.
How are those agencies, even though they're getting replenished with the rescue plan, we still have taxes, right? That is, what's the expectation in the next year?
You're bumming me out, Mary. It's a little much this morning. Okay, it's a little much.
Well, it's been a while since we talked.
Yeah, obviously you're very pent up and you've got a lot to talk about, but I'm trying to process the Delta variant right now.
Yeah, but it really affects how everything else is going to play out.
It's moving in concert. I understand totally, but it's also a reminder.
How does the government make a decision, and how it impacts businesses will determine how they end the year and start the year.
Right.
And we're really only essentially 4 months away from all of that.
Right.
And thankfully, honestly, we've had this time where we have learned a lot, but that was the whole point of herd immunity too, right? Is getting to 80% so that we can start dealing with these things and just continue to have the best practices of masking up and following the protocols. If everybody just did that, and like Doc said, even if, let's say they don't scale anything back, but they ask everybody just not to do social gathering the next 2 to 3 weeks. That's a great thing without mandating it. I think, that's, if we can all do our part to just stay home and work from home for 2 to 3 weeks. And if you have to go out, wear your mask. But what we don't want to see are things like, the roadblocks and...
No, don't say roadblocks. They're checkpoints.
Yeah, but we don't want to see that, right? We don't want to go all the way back to that. So we have to do something, but let's be reasonable about it too. Yeah. It has to be reasonable because a lot of people have things where there's so much shifting in the next month that I don't know how many people are really thinking about what's taking place in September.
Well, our governor didn't even know when the PUA ended, so there's that. But Mary, I think bright side is if the PUA ends and we do end up, just getting creamed by the Delta variant, God forbid, please, Lord, we do have $600 million sitting in the bank.
Well, that's something, I would love to see just more coming out to even the business community to encourage them to open up, more grants out there. Also, I know that Department of Labor announced at our economic forum that they're willing to pay the first 90 days for new hires. And so that's great news. And so I would like to see where that's at with DOL. GHRA also announced small business grant, series 4, I believe. And so there's some movement to try to revitalize the economy and the rehiring of it. But you still have to have revenue to open and to operate a business. Yeah. It can't just be grants and other, programs like that. You have to have a customer base and revenue to cover your operational costs and expectation of profit to pay your taxes. So a lot of that stuff is, that's why just having another setback is And I know it's important because the Delta variant is affecting a lot of people,
Yeah.
but there's just so much unknown.
Yeah.
And I think if we just knew more about the contact tracing and got people to go get their testing, which I know the governor is encouraging, that's really important. If you went to any of those places, go get tested. If you haven't gotten vaccinated, get tested because it helps build the immunity for the whole community, but it also prevents more variants being effective on us. And so it really is all part of the whole solution. And I think that's what we need to start talking about is the total solution of how do we move forward as a community.
Thank you, Mary.
Thank you,
Thank
Mary.
you, too.
It's good seeing you.
It is good seeing you.
Yeah.
Yeah.
Good to see you guys. Sorry it's a lot. I
No,
get,
no,
you know,
no.
really
No,
passionate
no,
about
no,
it.
no, not at all.
Hey, if you got more Balutan for next week, we'll take you on next week too. Okay, if you didn't finish everything.
No, I just really want to thank you guys again. You always really do a great job just covering all the issues. And, you know, I know a lot of people just are really excited that, you know, tourism did open up. Unfortunately, we do have this and it's going to be a bump in the road. But, you know, I think that as we continue to work with each other and have transparency and have a plan or build a plan, I think that's really more important because I don't want to talk just Airbnb, right? We want to talk about like the rest, like
Yep.
how are we going to get to next year?
Yep.
I think that's what businesses want.
Yeah.
And that's what the community wants.
Yeah, and it's tough. It's a tough question to answer because you know it's not just happening here. We're seeing this dance worldwide where we want to reopen,
Right.
but COVID says no. We want to reopen, and COVID
Yeah.
says no. Here I am again. So okay, Mary, we got to
Right.
run.
Thanks, Mary.
Thanks, you guys.
We'll see
Take
you.
care.
All right, have a
safe.
good weekend. Stay safe. Stay home. Follow your own advice. All right. We'll see. Okay, she is home. That's 9:46, Friday the 13th. Of course, all this is going to happen on a Friday the 13th. We're going to take a break, and then we're coming back with Feed Me Fridays. Okay, we're going to stress eat. Good morning. You all right over there, Bree?
Yeah.
Yeah?
fine.
Did you catch the